Good day, everyone. My name is Tolulope Oloyede from Team J. I will not be supporting this motion. Should African governments penalize hospitals and clinics that fail to adopt genomic testing protocols for antibiotic stewardship programs? And I am doing this with my co-participant, Mr. Muliro Samuel from Kenya. Antimicrobial resistance is a global crisis, yet penalization at this stage is premature. Many African hospitals lack infrastructure for even basic bacteriology. Genomic testing is not yet routine in stewardship programs, even in high-income countries. Sustainable approaches involve support, training, and phased rollout, not punishment. Penalizing hospitals and clinics for not adopting genomic testing is counterproductive in low-resource settings and may worsen inequities while burdening health systems already under strain. In high-income countries, genomic testing is not a routine part of stewardship. Support, not punishment, is what strengthens health systems. Or are we prepared to increase the death toll? These are my counter arguments. First, genomic testing is not routine anywhere. It's a valuable tool, very true, but not yet feasible as routine hospital practice. Stewardship worldwide still relies on prescribing guidelines and surveillance. It is mainly used for surveillance, not everyday care. It requires massive funding, advanced labs, and specialized staff. Secondly, there are huge infrastructure gaps in Africa. Most African hospitals lack diagnostic capacity. Less than one-third of African countries conduct routine antimicrobial resistance surveillance. Only approximately 1% of facilities are capable of basic bacteriology. Without this foundation, genomics is unrealistic. Thirdly, we have financial barriers. It may interest you to know that in many African countries, healthcare is paid out of pocket. In Nigeria, approximately 70% of health spending is out of pocket. In Kenya, approximately 20% of health spending within the rural areas is out of pocket. Antibiotics is widely sold over the counter across Africa. Hospitals cannot control the majority of antibiotics used. Antibiotics is also used in crop and animal farming. Support works better than punishment. Punishment creates fear among health workers. Fear reduces openness to report errors or seek guidance. Support strategies build trust and improve compliance. Training and mentorship have reduced misuse in African antimicrobial stewardship programs. For example, in South Africa, pharmacist-led stewardship program cut inappropriate use of antibiotics without genomics. If you're penalizing now, it is premature. That's because genomic testing protocols are still evolving globally. Most African countries lack national antimicrobial stewardship framework with genomics. Penalizing hospitals before systems are ready is premature. For example, in Ghana, only a small fraction of hospitals have genomic testing, with most relying on basic diagnosis. Nigeria and Kenya also face weak lab coverage and framework gaps. What we want is better policy alternatives, provide funding and technical support, offer incentives to hospitals adopting stewardship innovations, develop phased rollout plans for genomic testing, invest in training and capacity building for health workers instead of penalties. My teammates are supporting this because antimicrobial resistance is real and is urgent. Well, it's real, it's urgent, and it causes approximately 1.2 million deaths yearly. But does urgency mean we punish hospitals that lack the tools to comply? When we have fewer than 15% of African hospitals, you know, having molecular diagnostics as of 2022, how can penalties be fair? Majority have no capacity. WHO stewardship framework call for phased support and training, not punishment. We shouldn't ignore global best practice. More than 50% of Nigerians pay out of pocket for healthcare. Doing this will even push them further away from accessing this care and even make it more expensive. 54 gene collapsed in 2023, even though they were able to raise approximately $45 million funding. In 2025, a Lagos High Court blocked their assets sale. Our flagship company could not survive. And you want to punish hospitals. How will underfunded hospitals cope? About 70% of antibiotics in Nigeria are sold without prescriptions. These penalties will push more patients towards unsafe, unregulated drug markets. Genomic testing is promising, but it is still experimental as a tool for stewardship. Without the tools, the training and the support, penalties only deepen the cracks in already fragile systems and will not solve the crisis of resistance. If stewardship is to save lives, it must be rooted in partnership, not fear. Furthermore, in the spirit of antimicrobial resistance and One Health, shouldn't it be made law that every farming season, animals and crop farmers declare the antibiotics that they use, and this information be broadcast to the public and made available in healthcare institutions so that we can know the antibiotics that we may have been exposed to and made resistant to? Thank you very much.